Okay, so should you do Sculptra? Of course, people are saying Sculptra is the best thing in the world, and now we've had this debate saying, no, it causes scar tissues, it causes nodules, it's terrible, don't do it, it's rubbish, don't put it in your face. Like all things, there's a middle ground, and it gets more complex. Does it cause scar tissue and nodules in everyone? No, but it can. And so it's really important for us as injectors to look at a whole host of things. So Sculptra is not good nor bad. I actually, years ago, it was before I became an injector, I actually had a Sculptra nodule because they put it under my eye, which is like the craziest thing to do. It's worth having the discussion with your provider. If you're going to have surgery within the next year, maybe don't do any biostimulators or filler, just let everything settle down. If surgery isn't your option and you're really just looking for skin improvement, Sculptra is so good. And when we use the dilutions that we use now, it's like hyper dilute, it's almost like double the dilution of what they used back even 5 years ago. Your issues with getting nodules are very, very, very low. As far as it causing scar tissue, its mechanism is causing a different type of collagen. I've heard some great surgeons say absolutely, we've seen pictures of a more scar tissue on a facelift, but also I've heard surgeons who say, you know, someone who has threads and Sculptra and has done all the things, they've done a facelift, it's been fine. So we as an industry are growing, and we don't have the clinical data, so we're all trying to just learn from each other. But I know as a regular person listening to this one person say this is the best thing ever, and then someone saying this is the devil and it's rubbish and you shouldn't put it in your face, it's so confusing. Just keep going back to the basic principles of things and listening to renowned people and listening to the debate. But I'll keep you posted because I'm super interested. I love Sculptra for myself. And so that's why I feel good about my patients, but I really think about my patient selection and their goals. So anyway, that's me rambling about Sculptra, but I hope that helps.